everybody. Welcome to another episode of the Gyan Pravah podcast series, an initiative by the Fogsi president, Dr. Sunita Tandulwadkar. I'm your host for the day, Dr. Rohan Palshetkar, chairperson of the Fogsi Young Talent Promotion Committee. Today, we explore a compelling journey that connects the two vital worlds, the operating theatre and the policy table. And our theme today is Guardian of the Ethics and Excellence, a surgeon's journey from the OT to the policy table. In a time when medicine demands not only just clinical skills but also courageous leadership, today's conversation brings together those two dimensions through the remarkable story of our guest. But before we proceed, I want to give a heartfelt acknowledgement to our visionary Foxy president, Dr. Sunita Tandulwadkar. She's a trailblazer in the field of reproductive medicine and endoscopy. She has been instrumental in pioneering cutting-edge IVF techniques in India, and she's widely recognized for achieving several national firsts, including the country's first stem cell baby. As president of Foxy 2025, she's brought a wave of innovation, collaboration, and empowerment to the forefront of gynecological practice. Her passion for mentoring the next gen is unmatched. She actively promotes leadership among young doctors and has consistently encouraged out-of-the-box thinking through initiatives like the Gyan Pravah. A true visionary, she's not just known for her scientific achievements, but also for her compassion, mentorship, and ability to inspire. Her leadership motto, I want to create leaders, not followers, has touched thousands across the country. And under her presidency, Foxy has seen tremendous rise in educational and technological initiatives. It is through her inspiration and support that platforms like this podcast have become possible. Ma'am, thank you for this opportunity, and I would love to hear your inspiring words.
Thank you so much, Rohan. You spoke so much and so well, and I'm overwhelmed. I don't know whether I deserve each and every word what you spoke, but thank you for that.
You
Uh,
absolutely do, madam.
Professor Dr. Utture, thank you so much for coming on a Foxy platform. It's our honor to have the personalities like you, and I need to thank immensely to Rohan for this. Rohan, you are one of the leader. Dr. Utture, the idea about this podcast came because in our Foxy, the pattern is you become a committee chairpersons, you serve the organization and the country for 3 years, then you step up your ladder and become a vice president. You serve for 1 year, again you rest for some period, and then you enter in a Foxy presidency. So your nurturing from your chairperson post, and I felt I have 30 committee chairperson. Let 30 days, one day is designed only for that chairperson, where 1 hour dedicated podcast, the interview, the dialogue they have between the faculty and themselves. Now this faculty is a global achiever, maybe from our academic medical field or any other fields. It may be spiritual, inspirational, guru, or the political, all the film background. So many have come. More than my chairperson, I think I got evolved meeting such personalities, and I have noted down I need to meet physically, and the list is going every day. But today, Rohan has taken you. I'm sure this podcast will be very well valued. Saying about Rohan, Rohan, you are amazing chairperson. You have the quality to become president one day on this organization. You will definitely preside, and you have worked under many leaders already in a close proximity with your own mom, with Rishikesh. You observed the journey of everyone, and that has already evolved. While
Thank
working with Rohan, I see that he is very principled when it comes to the organization, giving respect to the highest chair, working for that chair is very important. Every time you wear this blazer, which I gave with love to all chairpersons, and you and probably Apurva are the only two who always remember to wear this. This is very important. These small, small points, that makes you different from the rest. So I wish you all the best, not only for this podcast, but your future journey. I
you.
know journey to Foxy presidency is long way, maybe 15 years down the line for you. I don't know where we will be, but wherever we are, we will be watching you. If we are in this physical world, we will be on a stage or a front line to cherish those moments. And wherever we are, we will be blessing you, Rohan. Thank you so much. I love you the most. Thank you.
Thank you so much, Sunita. Sunita ma'am, it's honestly something
The
I
auntie
honestly,
comes.
it just comes out. It's the love and
Because
the
for years together, you have called me Sunita auntie, and now changing to madam becomes, little bit difficult, and for me also.
absolutely. I hope with my guest also, Dr. Uttare, Kaka doesn't come out in the middle of the entire podcast. I will try and be as formal as possible, but at the same time have a personal equation in the conversation as well. But thank you so much for your inspiring words. Every time you speak, it's always inspiring, not just my generation, but the generations after me who are just entering the field. They understand what leadership is, what the entire qualities is to take the entire fraternity ahead, not just growing alone, but carrying everyone with you. I think that's something that's been truly amazing to learn from you. So thank you so much for being there. I've got another leader with me, uh, my guest for today, Dr. Uttare, and it's honestly an honor to introduce you. Dr. Shiv Kumar Uttare, he's a renowned general and laparoscopic surgeon, educator, policy influencer. He serves as the national vice president of the Indian Medical Association and has had several prestigious positions. He's been the former president of the Maharashtra Medical Council, member of the National Medical Commission, member of the Medical Advisory Council of India. He's been a former professor and unit head in the Grant Medical College and JJ Hospitals. Dr. Uttare has shaped generations of doctors. And his dedication is not just in the OT, but it's into institutional leadership, medical regulation, and ethics. He has numerous accolades. I'm only going to name a few, like the IMA National Award for the Lifelong Services, the Mahatma Gandhi Award at the British Parliament, London, COVID Warrior recognitions from IMA, FICCI, and municipal bodies. He's also the founder of the Dr. Shankar Rao Uttare High School for Girls supporting education in rural Maharashtra, which he has named so lovingly after his father. It's going to be a privilege to hear from a man who seamlessly bridged the clinical and policy worlds. So please join me in welcoming Dr. Shiv Kumar Uttare to the Gyan Pravah podcast today. Welcome, sir.
Thank you, Rohan. And today I'm sitting with two, I think, one senior and one junior doyens of Foxy. And just before we start, let me tell you, madam, just hearing those opening remarks from you, because I have n number of leaders I have interacted with in the past also, but it speaks volumes for why Foxy has gone on, gaining newer heights, because people like you who are there, who not only you all have achieved what you all have to, but what you have done is you have encouraged the younger generation to come up. That is in our field, that is the most important aspect, because I think amongst all the professions, it is only the medical profession which still believes in the age old what in India, that guru shishya, and that the guru trying to bring up the shishya, even if there's something lacking in that shishya. And that is what is most important. I think that's what I heard from you, and it's a privilege that today I'm there sitting with you and just having a conversation between you and Rohan today. Thank you very much for having
Thank you, sir.
invited me.
Thank you. Thank you for being, and it's an honor of Foxy to have you, sir. Now, the protocol is only you and Rohan get the limelight. You talk to each other, and I need to go to the viewers link to watch both of you. So I felt that's another favor I can give to my chairperson. If I'm there, I don't want limelight on me. I want my youngsters who are taking efforts in contacting you, creating. I know Rohan must have done a lot of homework to prepare these questions. So they should get that all due respect and importance. So I'll watch you all from the viewers link. Thank you.
Thank you so much, madam. Thank you. So, Dr. Uttare, honestly, I don't know where to begin, whether to begin on the policy making table or the OT table. I think that's a transition you made so seamlessly because it's something that actually is quite a bit of a challenge. But Let's begin with your OT table first. What is something that drew you to surgery and it kept you so passionate to stay in this field for so long? You always had the option of getting into the policy part earlier, but you still maintained staying on that OT table till date.
Yeah, basically, see that to answer your question, we have to go back to my student days and my residency days. During, especially in the student days, it was we used to attend the theaters, and at that time in our institution, we used to have what is called as a theater gallery,
Yeah,
where you used to be on the top, watching the surgeons operate below. We were never allowed inside the theater. And let me tell you, I was so fascinated with all surgical branches because it was as if like, a magician was at work when a surgeon is doing something. And, the challenge which is there because you have to think on your feet whenever you're operating. And especially the surgical field, where of course our main forte is the abdomen. Even when we study, we say abdomen is a Pandora's box. So you don't know what will happen once you open an abdomen. Though now things, of course, have changed a lot with the all the newer technologies of investigations which have come. But during our time when we were students, I think at that time the surgeon's hand was the only thing which was the most important. We did not have beyond simple X-rays. Even sonography had not yet come up at that time.
absolutely.
So it was always fascinating to watch my teachers over there working, in that field of surgery. And that is what basically made me want to take up surgery. And it was right in second MBBS itself, I decided that, yeah, I want to become a surgeon. And, that's how, I got interested in that field. I started working more and more, especially during the internship and all in my surgical unit. And as I said, the most important thing in surgery, which I liked, is that you have to take the right decision at the right time.
Absolutely.
Only then you can do good to your patients. And that is what pulled me. That was like a magnet that pulled me towards surgery.
I think that's absolutely amazing because I think at every point of time, whenever we enter as gynecologists, we say that when we know that there's an endometriosis or anything, till we don't go in, we don't have an idea of what the pelvis is going to look like. So it's literally like diving into the unknown. And clearly, you're a man who loves to explore new areas, new places. So it's something that obviously must have drawn you a lot closer, much faster. Speaking of these unknowns, which you said you didn't know what was going to happen, can you share like maybe a defining or the most memorable moment of your surgical career?
Yeah, if you talk about my initial period as a surgeon when I was working as a full timer in the medical college in Mumbai, uh, I was in an institution which used to get a lot of trauma cases.
Yeah.
And you're asking me, the main moment which really made me happy that I took up surgery was when a stab injury patient, multiple stab injury patient came, almost dead by the time he came because he was bleeding from everywhere. We had to revive him, and within half an hour, we took him on to the operation theater. And at that time, even he had stab injuries in the chest also. And CVTS is also in a nascent phase at that time, though we had that department. But since they were so overworked in that department, we used to rarely get them to come and, especially in a span of minutes when they had to come and assist us. And that's when we took the decision because we had to save the patient. We were losing him. We opened the thorax and he had a stab injury, which was not only through the lungs, but even through the heart.
Oh, wow.
It had slit the muscles over there. And that thrill of holding a live heart in your hand and suturing that, the patients used to always call us like, y'all are gods for us. Still, a lot of patients do that. But that's the time we felt that, yes, we were superhumans when I was doing that. And that was the time when I said, yes, I have chosen the right branch and I will work in this branch. The next change that took place as far as my surgical career was when laparoscopic surgery came into existence. There was no laparoscopic surgery when we were residents and in our younger days. And as by that time, I was already a honorary professor, junior professor at JJ Hospital.
Yeah.
And you won't believe it, it was my student, a lecturer who had, taken education outside in laparoscopic surgery, and he became my teacher at JJ.
Yeah.
So I was assistant professor and he was a lecturer, and that's where I learned exactly how to go about as far as tackling laparoscopic surgery is concerned. And I still remember at that time the cameras and everything else was, I would say, absolutely in an infantile stage, where the weight of the camera itself used to be almost about a kg.
Oh, wow.
So imagine holding that, and the pixels were, you can't even imagine the pixels with which we work, the instruments which were there. And that's how we started a career in laparoscopic. But then things went on improving. And I was one of the first ones to introduce laparoscopic surgery, where I was in St. George Hospital. Then, of course, at that time, we used to carry our own instruments all the way over there. And at that time, there were not many of Indian companies which were coming up with these instruments. These were all imported and pretty costly for that time also. But just to learn, luckily, I was in an institution, teaching institution, which let me learn laparoscopic surgery. So that was a time when, again, the whole direction of my surgical journey changed towards this. And today I'm doing both regular surgery also, and I'm doing laparoscopic surgery also.
Absolutely. I completely understand when you're talking about it that way. Just a simple example of what I remember from my mother's days. I can't say my days. My days, y'all had done your trial and tribulations. Y'all gave us a very easy path to follow. But I remember when mom used to tell me that, like you're talking about the cameras, at that time they would have to do that intracytoplasmic sperm injection between 2 a.m. and 5 a.m. because the trains would be shut and there'll be no vibrations. Now we have the anti-vibration tables and all, which definitely makes it easier. So before I end with the surgical journey and get into the policy journey of yours, I just want to ask you one thing. What's your message to the young surgeons who are starting out today?
Oh, what I would basically tell them is, what they have to understand is that surgery is an art. So you
Yes.
have to be an artist. And an artist becomes good in his field only when he does something repeatedly,
Yes, true.
right? So you cannot say that, I will just come in and do a hernia surgery for the first time, and simple hernia surgery also you will not be able to do
Yeah.
unless you have watched. So what I would tell the younger surgeons is, especially the resident doctors, that watch your seniors operating, imbibe the way they do. See, there are a lot of things that the books don't tell you.
Yeah.
How to tackle tissues, how to dissect these tissues. All these things you can learn only when you watch or you assist your seniors when when in your training period. And as a surgeon, let me tell you, you never stop being a student. Because even today, as I said, when I'm doing surgery, maybe I may encounter something very new. But today, when I'm encountering any new, because of my past experience, I can even tackle those new things. But a younger surgeon requires to see to it that he's well versed in this art of surgery. The respect for the tissues is something else that a surgeon must do. Respect the tissues whenever you are operating on that tissue. Become proficient in whatever you are doing over there. And definitely, the last aspect I would say is, know your limitations. Don't act God. There are some things, even at my stage, I say, okay, I cannot do this. And that is a time, I think, and I'll tell you, medical field is the only field that anybody, if he's in trouble, even while operating, and he phones up his colleague or his senior, they do come down immediately to help him out when in his, during this problem. So don't feel shy, because the life of a patient is under your hands when you're operating on that patient. Know your limitations. Once you know that you cannot go beyond this point, don't hesitate to take the help of your colleagues or your seniors so that you can do the best for your patients. If that much you do and understand, I think you can be a good surgeon.
I think that's such a beautiful message of calling for help. I don't think our ego should ever get into the way of saving a patient's life, making the right decision for them. And another beautiful thing that you said is knowing your own limitations. If it's out of your purview of expertise, it's always better not to do it rather than doing a half job of it. I think that's beautiful, sir. Again, now you've so far been a professor, you've been in all of this. From there, you transition to the president of Maharashtra Medical Council, vice president of the IMA National. What inspired you to transition from clinical work to medical policy and administration? What brought that change in?
Yeah, see, this was, I think, way back about more than, I would say, nearing 2 decades back.
Yeah.
What I found is, especially when I started becoming active in Indian Medical Association, and we used to get feedbacks from all doctors, our colleagues, and everybody. Maharashtra Medical Council was at that time a defunct institution. See, there was an administrator who was sitting over there for almost 12 years. And these administrators always are from the government institution doing the second job over here. So obviously, they cannot give their complete attention towards this job. And our colleagues used to find it so difficult to even get a simple registration after you have passed your MBBS.
Yeah.
It used to take months and years. And remember, the council, the basic work of that council is, number one, is to give you a license to practice. You may do your MBBS, you may finish your internship, but you cannot practice unless you get the license or the registration from the Maharashtra Medical Council.
Yeah.
Number one. And number two, of course, is whatever the ethical hearings are and all these things. In both these aspects, let me tell you, we used to find that almost 6 months to 1 year, anybody who has applied for a registration used to wait for that registration. And there were so many of our colleagues, obviously, you cannot waste your time, precious time after you have worked so hard to become a doctor.
True.
So they used to practice without a license from Maharashtra Medical. And of course, that time there was not much of the legal hassles, but today you know what the legal problems are that doctors are facing. Then if you required anything like simple thing, like if you want to go out to do some fellowship or do some training programs, you required a NOC or good standing certificate or whatever from the council, which people unfortunately used to not get, and so many of them lost that opportunity of going for higher studies.
Yeah.
So we in IMA, a few of us got together and we thought, instead of depending on a third party to all these things, for which we, the organization is meant to help whoever our members are.
Yeah.
Why don't we get into the system itself and try to fight this system from inside instead of, trying to find faults and cursing the system from outside. And that's when in 2010, we decided that, we would fight the election for MMC, which incidentally, the election was called because the High Court forced the government to hold the elections. Or before that, for 12 years, there was no council there. And we fought the election, we won the election, we got into the council. The first 5 years of the council, I was an executive committee member. And then, of course, the next election, again, I fought that election and then I became the president of the council. Yeah. And our first job that we did was to make it easy for all our members. And over the years, we understood that technology is the only thing that is going to decrease your workload of trying to get all these. And hence, we completely changed the outlook of the council. I don't know, senior members must be knowing how the council was. Initially, it was in a very small room of hardly about 800 to 1,000 feet with all, just like a classical government office with all papers and files strewn. You could not find anything. So we took it upon ourselves to completely digitalize the whole thing. And we could do that in the next 2-3 years. And today we can proudly say that for you to get your registration, especially your renewal of registration, which comes in every 5 years, we have timed it. it's a 3-minute job today.
It is.
It's so easy. If you want to get any of these certifications for going out and everything, today, right from 6 months to 1 year, we have brought it down to hardly 1 week. You can get all your certification, everything done. And if you request, the council also does it much more faster also. Sometimes we have given it overnight when they were in a hurry to get that. So this is basically to work for the community, which has given us name, fame, whatever you say. I think that was the main reason why I got into this institution as a council. Not only that, let me tell you, when we joined, there were more than 1,400 cases pending against the doctors in the Maharashtra Medical Council.
Wow.
Because the hearings used to be rarely taken. And let me tell you that even if you are innocent, the very fact that there is a case against you in the council means it is like having an FIR against you in a police station. To give you an example. So it is like a sword on your neck. Once you have a case, it is very difficult to get a good standing certificate because there is a case filed against you.
Yeah.
And there have been cases which were pending 15 years, 20 years, and our colleagues used to not get these certificates. Not only that, from the patient's point of view also. See, they also were getting so frustrated. There came a time when patients stopped complaining to the council because they said, anyway, nothing is happening in this council.
Yeah.
So from their point of view, so all these things put together, they basically encouraged me to work in the council. And I can say that I enjoyed working in the council, and we could do a lot for the fraternity also and for the society also.
Absolutely. And I must say that obviously I became a doctor. Like when I went in for my registration, the first time I went in for my registration, we had to go physically in, submit it. It took quite some time. But when I was renewing my Maharashtra Medical Council certificates, it was a piece of cake. And in fact, now the best part, what I feel that you all have done by digitizing the entire thing is that when we go in for renewal, our credit points are already uploaded. We don't have to bring those certificates in, and that's made life easier. So I must thank again, as I said earlier, from the earlier generation, we've not had to face the same trials and tribunals which you all have. You all have made the path and journey a lot easier for us. So thank you once again for that part as well. I must say that you speak very passionately about surgery, and I heard it in the first few questions that I was asking. I could see that glow, that glamour, which you, not glamour, but that excitement when you were talking about the surgery. Just the simple thing of you saying that when I held that man's beating heart and we were able to save him, you could hear the passion, it took you back so many years. How has your clinical background influenced your decisions, especially in the policy making roles, leadership? Because when we do look at certain acts, certain laws, we always wonder that why isn't there a clinician on board? But with you, you are a clinician who has been a part of all these policy makings. How has that influenced it?
See, basically your clinical background, teaches you to look at things in such a way that whatever changes you want to bring in, it should be practicable and it should be easy for whoever is following it.
Absolutely.
Unfortunately, what happens is, that any new laws, rules or anything comes, when it is done by an administrator who has absolutely, because whatever rules, regulations come on how we practice, the way we practice. And if those cannot be followed at the ground level, then the hassle start as far as our members are concerned. So this has gone because I had this clinical background, because I had this teaching experience, because that is also something that the council does. Even when I was in National Medical Commission, because one of the main work of the National Medical Commission is teaching as far as the whole of India is concerned. So how to bring about it's very easy to sit in an AC office and note down that this should happen, this should happen, this that doesn't help really our members as such.
Yeah.
So that basically, whenever we are trying to bring out any policy decision, like for instance, the technological changes which I was telling you about, when we sat with the technicians, they told us it can be done this way, that way, that way. I said, but how are the doctors who basically we are not told, so at least my generation are not used to that much technology. So make
Yeah.
it simpler, make it simpler, make it very easy, make it at a click of a button. And remember, this we are talking about more than 10 years back, not today when it is so easy that
Absolutely.
because we are used to this. So that definitely helped a lot in trying to plan out something which can be followed by everybody, especially when you're sitting on that chair in the council.
Yeah, that's true. I think that really makes a difference, especially I think clinicians eventually need to be a part of any policy making because they understand the small pinches that every practicing doctor would experience. So I think that was something that I think you had a major advantage when you were in making those policy making decisions. And I think that really helped us also, the clinicians which are there. Now, another topic which actually has been very close to you has been medical ethics, and that's been the cornerstone of your legacy. What are the biggest ethical dilemmas you've seen in modern medicine, and how do you think we can navigate them?
Yeah, basically for that you should go back in history, When we were students, when we were young surgeons, we were never taught ethics.
Yeah,
You know, what little bit we learned was, just observing our seniors, our teachers. That basically taught us how to interact with the patient, that is all.
yeah,
But let me tell you that though the code of ethics was there in 2002, even I had not read the code of ethics till I came into the council.
yeah,
And that is a sad part of what had happened to the Maharashtra Medical Council. I think now every student does read up on what he should do and what he should not do, which is much more important. And therefore, what I thought is when I got into this council and that's the first time I read, I said these ethics are nothing great. They're so easy to follow. The problem is that we do not do it because we have never read about it. Simple thing I'll tell you, like especially in the surgery, because I'm a surgeon, I'll talk from the surgical point of view.
absolutely.
How do you take a consent ethically, right? I remember when I was in Sion Hospital as a resident and a lecturer, the consent was I am willing for any surgery under any anesthesia and signed. This for years we have been doing that in thousands of patients. But gone is that. Now the patients are also empowered. Let me tell you, the patients also know a lot of things. And today it is unethical for you to take such a blanket consent. This is just example I'm giving you of what we have learned over the days. And that is what I thought what is happening is basically nobody teaches people, or what they are supposed to do. Another aspect when I was sitting in that council, and that was the sad part, is that we had these ethical hearings which were there, and at that time, my teachers, whom we used to look up, when there were cases filed against them, it was so sad to see them sitting in front of you. See, as I told you, Guru Shishya is still followed as far as our profession is concerned. And I had to question them because obviously I am sitting there as a judge because we are a quasi judicial body. It is almost like a civil court powers we have got in the council. And unfortunately, they came out saying that I didn't know we were supposed to do this. That is because they were never taught. I think we have changed it in the new NMC teaching curriculum also now. Ethics and bedside ethics are being taught in your
Yes,
curriculum itself. So
absolutely.
that is a change which has come over as far as the National Medical Commission is concerned. And second thing, let me tell you, it was after the whole hearing of the case, where you ask the patient to talk, what his complaint is, then the doctor gives an explanation of the whole thing. After that, we find that nothing wrong as far as the treatment is concerned. At that time, what the patients, majority of them used to say, doctor, if I was explained these things, I would have never come over here to the council complaining against you. So that is another thing that you must learn how to talk with your patients, how to give them information. They have got a right to know everything and they have got a right to even refuse the treatment. Today the ethics has come to that stage. So the relation between a doctor and a patient, which was paternalistic in the past, today it is mutuality. It is mutual between you and the patient. Both have got the same rights. So no more you can say that I say you do this, so you do this. No, if you talk to the patient properly, and this is what I basically try to teach whenever I'm, there was a time when I used to give a lot of clinical lectures in CMEs and everything. But let me tell you, last almost 15 years, they only call me to talk about medical ethics and all these doctor-patient relation. So I tell my all my colleagues, see, if you learn all these things, definitely we were a generation where there was no cases filed against you. But today, for the younger generation, let me tell you, that is not going to be the norm. It is going to be an exception. The norm is going to be there's some case which is going to be filed against you. And if you have done what is right, there is nothing to worry.
Absolutely. I've actually attended one of your lectures on medical ethics and communications. I must say that that's something I tell all my residents that I'm like, listen, just be courteous, make sure that you're very clear in what you're communicating with the patient, because at no point do you want something like this. It could just be a slip of tongue which has mistaken. So whenever you're taking a consent, make sure that you're explaining. In fact, even in today's practice, when I'm doing my IVF cases, there is in the consent, we say that this is not a procedure that's going to give you a 100% pregnancy result. And some patients are actually reading the entire consent. And even in the consent form, even though we know that the chances of any of the transmissible diseases is not happening, in the consent form, it's always written that there is a slight risk of it. So patients ask, they're like, we're not willing to take that even 1% risk, which is there. And it's then at that point you have to sit with them and explain to them how the transmission and all works. And as you said, it's very important that our communication, our medical ethics, all a patient-doctor relationship, these are topics which the National Medical Commission has brought in, are things which were required back from almost 20 years ago. But I'm glad at least that those changes have been brought in today, and we're taking a step forward to ensure that our doctors are well protected as well. I think that was something that you spoke, but I have to talk about, I spoke about this when I was introducing you about your participation during the COVID. I shouldn't say participation. I should actually be saying one of the key people who worked there with your key personalities that were there in the COVID times. I must say that you all streamlined a lot of things. The first wave, I think we were so well prepared that challenges that you faced during that time, because it was something I'm pretty sure you've never faced. There have been other situations which keep coming, going, and but a pandemic, I thought I've never seen in my life, but I'm sure even y'all have never seen a pandemic in your entire lifespan. So what were the biggest leadership challenges and what did it teach you?
Yeah, see, I think that was another, what you called right in the beginning, the defining moment of my whole career. That was the COVID time when at that time I was the sitting president of the Maharashtra Medical Council. And I used to get phone calls and let me tell you, Maharashtra Medical Council was one of the only institutions which kept on working throughout the COVID period.
Yes.
I used to go to the office regularly because at that time doctors were allowed. We used to have that red sign on a car.
Yeah.
And I used to have, I spoke with some of my, staff over there. And in rotation, we used to call them. So at that time, I used to get a phone call that your doctors are not working, you're not coming to the clinics, you're not doing this, that. And I used to tell them, how can you force the doctors to work? Tell me which are the profession you're working. So what you require to do is you require to educate the doctors of why they should be working instead of saying that you come out and work. Nobody will do that. And that's where, we took up this challenge. And in the COVID time, I always believe that leadership is not ordering someone, but leadership is someone who's right in the front.
Yeah.
And people will see you and then they will follow you. And, the biggest moment for us came where I practice in Mahim, and next to Mahim is Dharavi.
Yeah.
Came in when it was like a ticking time bomb in Dharavi. As you are aware, Dharavi in area of hardly 5 square kilometers, there were almost 9 to 10 lakh residents over there, and this is a floating population. It is not a population which so they move about. They want to move about. They are not. They don't have that their residence or anything over there. And at that time, I was approached. I've got another Mahim Dharavi Medical Practitioners Association, which we have in this area of doctors from there, Mahim
Yeah.
and Dharavi, where we were called by the corporation and we were requested that at least in Dharavi something we should try to do so that that doesn't explode over there, because that's what he was scared of. Everybody was scared of that. That's when, a couple of my colleagues, that Dr. Pachnekar, Anil Pachnekar is also there, and many more of them, we sat together, we discussed with the commissioner, and we came out with a plan along with him. And we said that instead of opening our clinics and expecting the patients, why don't we do a door-to-door survey and try to, take away the patients who are suffering from COVID so that they don't spread. And at that time, you remember they used to say one person could spread in the next 24 to 48 hours to almost 15 people.
Yeah.
And that goes on multiplying. Luckily, my colleagues who were there, I think hats off to them also, they were very brave. We entered Dharavi and we went, especially they chose 5 areas which were the most affected. And we literally went door to door. And more than 50,000 patients were seen in a span of 30 days.
Wow.
And we could remove almost 800 of them who had symptoms of COVID. At that time, remember, even getting the tests and all were done was very, very difficult.
Yeah,
on the
it-
initial phases.
absolutely.
So it was a clinical judgment, and we could isolate them. And I'll tell you, that really helped because that kept the whole COVID problem uh, away, from this Dharavi region. It was not affected that much. Then, of course, once we finished this, phase 2 was trying to encourage the doctors to open their clinics.
Yeah.
And that's where I used the platform of Maharashtra Medical Council, where, we were the first council to start this online study, CMEs and everything.
Yes.
Yeah. So I got all the experts from different fields, ICU experts, ENT experts, neurologists, and everybody who could talk on COVID. And we had a 2-day seminar on this online.
Yeah.
And you won't believe it, we had around more than 35,000 doctors who joined that for 2 days.
Oh, wow.
And we could educate all these doctors on all these aspects of COVID and why we should be working and everything. And that's where slowly the doctors started coming, opening their clinics. And that definitely helped, especially in a place like Mumbai, it definitely helped everybody. And all over Maharashtra, our colleagues joined this whole movement. And, it was really, in the world, it has been appreciated. And especially the Dharavi project has been appreciated by WHO, has been appreciated by the PMO office, the CMO office. And I was lucky to get this COVID Warrior Awards right from the Film Institute to the Actuaries Council, where I had nothing. I had not even heard about them before this. And, the municipal commissioner, government, everybody. But then we really work, and that is another aspect in medicine, let me tell you. We try to work without thinking of what returns we would be getting.
Yeah.
And because this is ingrained in us right from our student days, we could definitely make huge changes as far as, management of COVID is concerned.
Absolutely. I think, honestly, some of these stories we still didn't know about. I think a lot of people are going to be hearing this for the first time about what you all have actually gone through, made sure, because I think our biggest fear factor was the Dharavi area, at least for all of us Mumbaikars who are living here, that we were concerned that that would be the focal point from where it actually spread. And the way the Maharashtra Medical Council, the government of Maharashtra, everyone came together to make sure that the spread wasn't rampant and it wasn't more in. See, the spread was inevitable, but in such a contained manner where it didn't actually affect our healthcare services. I think that was something that was actually hats off to all of you, because we couldn't imagine how beautifully it was conducted in the entire way. I myself was doing COVID deliveries, so I know for a fact it was quite a challenge. But when you're talking about 50,000 people, I may be talking about 50 to 500. So I think the numbers are exponentially off. But I can't even imagine going surveying, seeing all these patients, taking a clinical judgment, making sure that they're taken care of because they're having these symptoms, ensuring the spread doesn't happen. That takes another level of management, and hats off to you. Hats off to you. I must say that was something that is unbelievable.
Another thing, I'll just interrupt you over here that we learned in COVID, let me tell you. At that time, we did not have PPE kits, we did not have masks, they were so costly, etc., etc. And that was another field which I took. And we worked on getting donations as far as PPE kits, masks, especially for the residents in every medical college, and the PPE kits to be given, the face shields to be given,
Yeah.
and beyond that, even the oximeters and ventilators. And once we started working, there were people from the society who just after hearing what we are doing, they used to contact us, and in lakhs and lakhs they have donated for getting all these things done. And almost all the hospitals I must have roamed about all over Mumbai, and giving donating these PPE kits, the mask. I must have through all these NGOs, and I must be very thankful for the citizens of Mumbai also, where even individuals came out and they said we want to do something. What do you want us to do? So we used to say, okay, you buy these PPE kits and give us so that we can give it to the doctors who are working in all these centers, at that time, because initially, if you remember, the residents were working even without PPE kits and without
Yes.
the 3M masks, with the simple surgical masks they used
Yeah.
to be working at that time. And the other aspect was the remdesivir and the tocilizumab,
Oh God.
which that created havoc. So we got a lot of donations as far as that is concerned. And let me tell you, even tocilizumab, through a few of my friends, for the first time was introduced in Mumbai when I took it to Nayar Hospital, because Kasturba was the first center to start. And that's
Yeah.
where tocilizumab started being used at that time, costing almost 40,000 plus per
Bye.
injection. And it must be around at least 125 vials, which we got from donors. And we, this was basically used in the ICU when they were on ventilators and everything.
Yeah.
And that helped a lot and gave us a lot of satisfaction working.
No, I must say that it was a different time. Even though we think that COVID went long time ago, I think it's just 2 or 3 years back where we were going through the second and third wave of it. And how things have changed is unbelievable. I know we've been talking about a lot of serious things up till now. Now I'm going to get to a little bit of a fun part where we want to hear about the more humanitarian, the more fun side of Dr. Utture. So this is going to be a rapid fire. So we want quick answers from you. OT table or policy table? Where's the high pressure?
Pressure is more on the policy table, but enjoyment is more on the OT table.
Fair enough. One medical law every doctor should be aware of.
The code of ethics, because day-to-day practice, that is what governs what you should do and what you should not do. So everybody must read the code of ethics which is there, which governs us.
Scrubs, suit, or kurta? What's your go-to look for a tough meeting?
I have been in, not in kurta, but at least in scrubs and suit I have been. Kurta I have not tried that aspect still. But definitely, I'll tell you, more than suit, the respect that is shown to us by the non-medicos when we are in the scrubs is
True.
much, much more higher than when we are in a good suit. Let me tell you that.
Absolutely. A habit that's non-negotiable for ethical practice?
Transparency.
Absolutely.
Whatever you do, it should be very transparent. And when you're transparent, you will always do the right thing.
One word your students would use to describe you.
Ah, I think they would definitely say a tough taskmaster. And because once I used to enter the OT, there were some things which everybody had to follow, whoever they are. So maybe but definitely, let me tell you, even today, whenever now it's almost 4 years, 5 years since I've retired from JJ. But when I go to JJ even today, and all my students now have become assistant professors, associate professors. They do come to wish me. Some of them still today touch my feet, and that pleasure that you get, I don't think anybody else can give you that pleasure.
Absolutely. Just my last question for you. What's your vision for the future of healthcare in India?
Oh, yeah, I'll tell you. Definitely, medical education requires a lot of revamping to be done. We have already started that when I was in the NMC, but a lot still needs to be done. Second thing, healthcare, as far as the government, this is a discussion I've been having with a lot of government entities. Government should be basically, I feel personally, should be in the primary and secondary healthcare system. The tertiary healthcare system, they should leave it to the private sector. And the government, for the people who cannot afford, should, join hands with the private sector so that it can be open to even those people. Because
Absolutely.
government has no role today in India where primary sector and secondary sector is, suffering so much. They don't have a role to go for all these hi-fi things. Let leave it to the corporation, and you have a tie-up like what we call as a PPP model.
Yes.
The private,
Public
public-private partnership
partnerships.
model, where definitely even the patients who can't afford it can definitely go and this. Then, of course, I always tell all my students that empathy is something that slowly we are losing out as far as whenever we are managing our patients. Empathy should be there, but you should remember that it should be empathy and not sympathy.
Yeah.
Okay, because the patient and treat the patients at your level. I always tell my students that when a patient comes to you, it is a meeting of two experts in their own field. The
Yeah.
patient is an expert in his problems,
Yeah.
and we are the experts in trying to how to manage.
Yeah.
So therefore, listen to what the patient says. Another aspect is that don't completely depend on technology, because today I find that many times patients come with you with a CT scan, MRI scan, and all the scans possible, and you are before examining a patient, that I see, especially my students, they going through or scanning through the scans. That
Yeah.
is not how medicine is. The scan can also be wrong. It is your clinical judgment which is corroborated by your scan study, so don't depend on that. And the newest thing which also I am very much new to today, and which I tell all my students, is artificial intelligence. This is something which is going to be a game changer as far as medicine is going to be in the next 1 decade. So it is better you embrace it instead of saying that why we require that, can it replace a doctor? No, it will not replace a doctor, but your life will be much more easy, just like how CT scans, MRI scans made our life so easy, because no more we do what is called as exploratory laparotomy. We know what we are doing when we go
Exactly.
down in the abdomen. Same way, AI is something that you have to embrace. AI is something that if you do not embrace, you will be redundant.
Yes.
You will be a dinosaur in the medical field if you do not know about AI. So try to learn AI in the initial phases, and definitely it is going to help you in your future practice.
Absolutely. I think those were some beautiful messages. Thank you, Dr. Utture, for your beautiful insights and reflections. Honestly, your journey, which you've literally talked about from your college days through your policy making days, and even now you've mentioned about your retirement from JJ, it's honestly amazing. I can't believe we've been talking for the last 1 hour. I thought we were, I said, I actually was thinking, I'm like, are we running short? Matlab, have I taken the interview too short? Why is it getting over so quickly? And then I just glanced at the clock and I was like, wow, we've actually been in a beautiful conversation and it's been so interesting. Thank you for talking about the entire part of advocacy, the vision, also the medical ethics, the way you've actually told us how a thought process goes from the surgical table to understanding what your colleagues need and how to actually make a difference by getting into the system rather than staying out of the system and saying ये करना चाहिए था वो करना चाहिए था, actually going down to the grassroots and making that difference. It's been beautiful. I again have to give a special thanks to Dr. Sunita Tandulwadkar, ma'am, for leading us into this new era of open dialogue and leadership. And to all our listeners out there, Thank you so much. Please keep learning, keep leading, and please remember this podcast there every day at 8 p.m. So tune in again for tomorrow's podcast as well. Dr. Uttare, thank you so much for taking out your valuable time once again and gracing us with your valuable wisdom. Thank you very much.
Thank you. Thank you. It was a pleasure and it was a good experience for me to go back in time also.
Lovely. Thank you so much,
Thank
sir.
you very much.
Take care. Good night, everybody.
Good night.